Welcome to Live It Up, the show where we explore and discuss how to take your life to that next level and beyond. We cover health, wealth, relationships, and how to create a life you absolutely love. I'm your host and coach, Fletcher Ellingson. Amy will be joining us after the commercial break, and today she and I will be talking about kidney stones. Ouch! Who gets them? Why do they get them? What do you do to avoid them? And of course, if you do have them, then how do you best treat them? Remember, health is the first wealth, so stick around for the answers. But before we get to that, I want to remind you that if you have questions that you would like us to answer on or off the air, you can email them directly to me at fletcher@fletcherellingson.com. I also want to remind you, if you feel stuck in an area of your life, whether it's financially or in your health or in your relationships, then get in action. Reach out to us. You don't need to suffer, because there are answers and there are solutions and people that are out there and available to help you. And there are lots of ways to get unstuck and move forward powerfully. And I also want to tell you about a special opportunity happening in November. And if you're a fan of our show and a fan of personal development, if you believe that your thoughts and the way you think actually have something to do with your destiny, and if you're the kind of person who is interested in expanding your horizons and taking on your life and stepping into your personal power, then we want to invite you to join us for a 2-day seminar that we're hosting in Chelan called Access to Mastery. And we would love to have you join our tribe, join our community. Come and hang out with Amy and me for a couple days. There's going to be so much cool information. For instance, did you know that each day we have about between 50,000 and 70,000 thoughts? And did you know that most of those thoughts we had the day before, and the day before that, and the day before that? The exact same thoughts. And did you know that most of our thoughts are just automatic? It's important to realize this, as this is one of the things that influence the results that we get in our life. We're going to show you how to begin to create new thoughts, how to turn off the autopilot and get into the driver's seat of your life. It's going to be a blast, full of fun activities, music, mind-blowing content for people who want to have a breakthrough in their businesses or their health or their relationships. If you want to learn how to end procrastination, or if you want to discover your life's purpose, this will be the time and place to do it. It's going to be so cool. We're going to help you uncover what may be holding you back from fully taking on your life. Maybe you've got some big decisions to make. Maybe decisions you've been putting off for a while. This would be a great place to finally make them. Or maybe things have been going well in your life, but you're like me and you want to experience that next level, right? So I'll tell you what, if you feel stuck or bound in an area of your life and want to really feel free, this is your opportunity to do it with other like-minded people in a safe and supported environment. I tell you what, I've been to all sorts of personal development seminars. I love them. I love being inspired by other people, stepping into courageousness and being willing to create a fulfilling life. Now I got to tell you, seating is limited. It really is quite limited, in fact, and this is going to be on a first-come, first-served basis. So if you want more information about this live course happening in the fall in November called Access to Mastery, then I want you to join us there in Chelan, and we'll get the dates on the website. But if you want more information and about pricing, exact times, if you have questions, email me. Again, that email is fletcher@fletcherellingson.com. Details will be on the website at fletcherellingson.com soon, but we're just giving you a preview of this, so you're some of the first people to hear about this. I want you to know that the life you dream of really is possible. And I'm so lucky because I get to see this again and again through the lives of my clients. I see them lose the weight and, more importantly, keep it off. I see them finding the partner of their dreams when previously they thought there was no one out there for them. I see people reversing chronic disease. I see people creating wealth and really creating their own economy. What a cool concept, right? It's all possible. I remember hearing speakers and seeing people in courses, and I would spend time sharing these incredible stories, or they would just spend time sharing these incredible stories about how much money they were creating by following their passions. And I have so many people say that they're making more in a month now than they used to make in a year. And I used to think that was total BS. But now I actually know these people. I see them doing it, and I hear their stories, and it's incredible and inspiring. Anything is possible. So this seminar is going to help you rethink things. And if you've been putting off an area of your life and it's time to take it on, then join us. We want to hear your story too. We want to support you and encourage you in a way that allows you to move forward powerfully. Again, you can email me for details at fletcher@fletcherellingson.com. All right, we're going to take a commercial break, and then we're going to be back with Amy. We're talking about kidney stones. Stay with us. Hey everybody, welcome back to Live It Up. We are here with Amy. Hey Amy.
Hello.
Hey, what are we talking about today?
Kidney stones.
A fun topic.
I know, I feel like it's not a fun topic, even just to say the word. I feel like we should be like, oh, kidney stones.
Yeah. All right, so let's get to it. What exactly is a kidney stone?
Right. So a kidney stone, it's a hard object like a stone that's formed from chemicals that are in your urine. So your kidneys basically...
Just a second, I just want to back up. These are formed by chemicals in your urine?
Yes.
Okay. Because
your kidneys basically distill, there's like this, your body, like we talked about, is so amazing. There's this filtration system and pH is involved and channels are involved and everything, taking your stuff from your blood. And then your kidney, it distills it into urine, all these waste products, and then it comes out as urine. So stones, one way that stones can be made is if there's be a little bit too much of a certain types of waste material and too little liquid, so it causes some crystals to form. And that would be like if you're dehydrated or not drinking enough water. And then the crystals attract other elements, and then they all kind of come together to create this stone. And that will get larger and larger unless your body passes it out in urine. So the chemicals that usually form stones would be calcium, oxalate, urate, cysteine, xanthine, and phosphate. So usually these chemicals are eliminated in the urine by your body. It's like this master chemist. The kidney does all this. And then in most people, there's enough liquid in your urine, or the pH is fine, or whatever else maybe goes wrong in people that have kidney stones. Usually things just pass out without a stone being formed. Mm-hmm. But when that doesn't happen, that's when the stone is formed.
Got it. Okay. Very interesting. So where do the stones get formed, and what part of the body do people who have them, are they experiencing that pain?
Yeah, so the stones are formed in the kidney. And so actually, if you were to do, CT scans on a lot of people have some stones up in their kidney, like up in what's called the renal pelvis, this little open area kind of. The stones can kind of hang out there and never move and never cause any problem. The stones only cause pain usually when they leave the kidney. That's where people experience all that pain, is between, it goes kidney, ureter, bladder, urethra, which is out. So the pain is usually in the ureter. Once it drops out of the ureter into the bladder, then usually it's going to be just fine. There's not going to be a lot of pain.
So the pain is not passing it as you're urinating, it's before that.
Exactly, it's up in the ureter. So a lot of times if the stone is tiny, people maybe don't even feel it, or they might have a little bit of a problem. If it's bigger, it can cause a lot of pain and can even cause a blockage in the ureter where it backs up into the kidney.
Gotcha. You talk a lot about risk factors when it comes to most of our topics. So what are the risk factors that increase the chance of having kidney stones?
Yeah, there's definitely a lot of lifestyle stuff and risk factors. So the peak age for kidney stones is between 20 and 50 years old. Caucasians are more likely to develop kidney stones than other races in America, and men are more likely to have kidney stones than women. Kidney stones definitely can run in the family, but only about 25% of people, so a quarter of people with kidney stones, have it in their family. But that's definitely a risk factor. So other contributing factors would be drinking too little water, like we talked about.
Hydration.
We had a whole show on hydration. So because, again, if there's too much waste for the amount of liquid, then the waste can kind of clump together, and then it attracts things and causes a stone. So you're basically diluting all the waste that your body is trying to get rid of by drinking water.
Yeah.
And like we talked about before, really the goal would be to have your urine be clear, by late morning and stay that way the whole day. That's how much water I drink personally and would recommend.
I can attest to that.
I know I drink a lot of water. Obesity is a risk factor. Weight loss surgery is a risk factor because of the changes that occur in the digestive tract. You can have a higher amount of oxalate in the urine. Eating food with too much salt or sugar. The fructose is actually what can be broken down into oxalate. So fructose is in table sugar and obviously is also in high fructose corn syrup. Diabetes increases the risk of kidney stones, especially in younger women. And then if you've had one stone, you're for sure at risk of having another stone. So those who've had one stone have about a 50% chance of having another stone in the next 5 to 7 years.
Okay.
Which nobody likes to hear that.
Nobody. Hey, we've got a friend who has a rare condition causing kidney stones, but for the more common types, how many people are affected?
Yeah, so each year more than 500,000 people go to the emergency room for kidney stone problems, and it's thought that about 1 in 10 people in their lifetime will have at least one kidney stone. Mm-hmm. And the number of people in the United States that have kidney stones has actually been increasing over the last 30 years. I don't really know why. It might be because of obesity and diabetes. And those factors, maybe more sugar in our diet, which we know that's a thing. So in the late 70s, less than 4% of the population had kidney stones, and by the early 1990s, more than 5%, and the rate keeps going up a little bit for that. Yeah.
Interesting.
Yeah.
It seems like they're painful. What are the usual symptoms of a kidney stone? Like how would I know if I have one?
Yeah, so again, some kidney stones might be as tiny as like a grain of sand, and then you wouldn't even notice it at all probably. Others can be bigger, like a pebble, and then some can be even multiple centimeters in size. And so generally, if a stone is larger, it's going to cause more symptoms. So the symptoms that usually people describe are in the mid to lower back. It's kind of like in this area, and then frequently that pain radiates down into the groin just by the way the nerves are, so it kind of travels down into the groin area. And the thing that's really different about this kind of pain, we call it renal colic, is that it doesn't matter what position you're in. So other types of pain you can move and you're like, oh, this is a good position. Kidney stone pain, it doesn't matter, right? Because the stone's still there. So no matter what position you're in, the pain's the same.
You just can't get relief.
You can't get relief in any position. And that helps you maybe give it either as a clue, especially for me, if I'm taking a history on someone, that's going to be part of the history. That makes me think of a kidney stone. Blood in the urine is really common, either blood that a patient can actually see, or then almost always, if they can't see it, we're going to be able to test it on microscopic testing. Sometimes nausea and vomiting. Fever and chills.
And is the nausea vomiting just from the intensity of the pain?
It could be the pain. Also, there's just something that happens when you have that kind of, the nerves that get involved with that type of pain can make you feel nauseated. And then if you have fevers or chills along with what you think might be a kidney stone, that's actually an emergency, because if someone has a kidney stone and a kidney infection at the same time, they can get really sick really fast, and they need to get on IV antibiotics and get the stone out. Mm-hmm. So the kidney stone starts to hurt when it causes irritation or blockage, and this leads to this rapid kind of increase in pain. And, people, again, kind of liken it to maybe the only thing that might be equal to childbirth pain. I mean, I've never had kidney stone, I have had babies, so I don't know. And it's different type of pain because, like I said, you can't get away from it with position.
Got it.
Yeah, and the pain is happening when the stone is in the ureter.
Mm-hmm. Yeah, and as you said, they can get big. We saw, what was that image that we saw? We saw an image of our friend's
CT scan of his.
CT scan, and I mean, they were shockingly or alarmingly large. I mean, they were easy to see, right?
Yeah.
It definitely looked like a foreign object. So yeah, can't imagine having to deal with that.
Yeah, I know.
Hey, how are we doing on time? We need to take a break?
No, one more little section, then we'll do a break.
Okay. So let's talk about if someone's having those symptoms that you just talked about, how is a kidney stone diagnosed?
Yeah, so again, like all the things I talk about, when you go see your doctor, they're going to take a history and a physical exam, including testing of the urine to look for blood and rule out infection. So that's going to help us, the doctor is going to be fairly certain that's what's going on, even just by the history. And then imaging tests are almost always going to be needed to know for sure what's happening and to know exactly how big the kidney stone is, where it is. Is it almost about to drop into the bladder and then that person's home free? Is there an obstruction involved? Is it big enough where we think, oh, this is not going to pass on its own? So usually that's going to be a CT scan of the kidneys and bladder, and it's a quick and easy test to do. There's also a special type of x-ray called a KUB that has the kidney, ureter, bladder, and you can definitely see the stone on that too. And that usually is used less often, and that's usually used like maybe after a surgery or done to know if it's gone. But usually CT scan is what we do most commonly.
Okay.
All right, and now we're taking a commercial break.
You heard her.
We'll
We're
be
taking
right back.
a break.
Yeah.
We'll be right back. Hey everybody, welcome back to Live It Up. We're here with Amy and we're talking about
Kidney stones.
not a fun topic, but it's good information.
And I feel like it makes me uncomfortable just thinking about it.
Yeah, and we have a good friend who gets these, and it's boy, you do not want to have these. I totally feel just so much compassion for that guy.
And yet it doesn't make you drink that much more water, does it?
Busted. All right, so let's get back to the questions. So I've heard of people like they have to actually collect the stone that they pass and bring it to the doctor. What's that about?
Yeah, if it's like the first time you have a stone, at some point that stone needs to be collected and examined at the lab to know what type of stone it is, because that helps us know a variety of things to help prevent them, treat them. And there are 4 types of stones, and each one, has like different dietary recommendations and medical interventions, and so it really does matter what type of stone. So people are usually sent home with a little like collapsible baskety thing that they then pee in, and then it would collect a stone, and they basically do that until they pass the stone. So the most common type of stone contains calcium. So the kidney removes extra calcium that the body doesn't need, and often people with kidney stones, they keep a little too much calcium in their bloodstream. So it's not usually that they're eating too much calcium, it's just how their body's chemistry is, and then also if they're not staying hydrated enough. So the calcium usually combines then with oxalate, which is another one of those chemicals that I mentioned that's a breakdown product of eating. And so the most common type of stone is called a calcium oxalate stone. That's what we see most commonly. The less common types of stones, there are some stones that are associated with chronic infections, and they have magnesium and ammonia in them. They're called struvite stones. You can see how much chemistry is involved that our body is doing all the time. And then there are uric acid stones, which can be related to eating too much protein. High protein diets can do that. And then the rarest type of stone, which is what our friend has, is called a cystine stone. And that definitely tends to run in families and can start at a very young age. And people in that group have, them all the time. Yeah,
and just to give our listeners an idea of how many stones people can produce, I mean, he brought out a vial of stones that he's collected. It was like 80 stones or something.
Yeah, but he has that very rare type.
He has the very rare type.
So we don't have to scare people about that.
Yeah, but
it's not common.
that was shocking.
Yeah, I know. Yeah.
All right, let's see. So if someone has gone to the ER with a kidney stone that needs attention, what's the most common next step for them?
So obviously if someone goes to the emergency room, or even in the clinic for that matter with a kidney stone, but for sure in the emergency room, they're usually given IV pain medication like narcotics. And then also anti-inflammatories like IV Toradol, that also is very effective. People might think, oh, well, I don't want to take naproxen, my pain's too bad, but actually it's quite effective for pain in the ureter. And there's also a medication that can help relax the muscle in the ureter that can be effective, although some studies show maybe it wasn't that effective, but it's free, sometimes given, sometimes not. So if the stone is thought to be small enough, like say either the pain's not that bad or on CT scan it's not that big, then the person's usually sent home and told to drink lots of fluids, given some pain medication, given a strainer, and then they're supposed to return the stone. They would probably follow up with their primary care doctor or a urologist to talk about that once we know what type of stone it is.
So really just kind of a wait and see until you pass it.
Yeah. And again, depending on what the imaging shows. If the stone is too large that we think it's not going to pass, if it's blocking urine, because if the kidney gets obstructed, where urine is backflowing up and causing pressure in the kidney, that can actually cause permanent kidney damage.
Mm-hmm.
So if that's happening, if the stone's too large, if there's sign of an infection, then the stone really needs emergent attention. So like in Chelan, we send people down by ambulance down to Wenatchee if that's the case. They actually need to get it taken care of. So usually the most common intervention is called shockwave lithotripsy, and it's a non-invasive procedure where they use high energy sound waves to blast the stone into fragments that are small enough to pass. The only problem with that is that they need to put a stent up in the ureter that keeps the ureter open to allow the stones to pass without so much pain, but there is some discomfort with having the stent in, and then the stent has to be removed, which is not that comfortable.
Right.
But it's better than kidney stone pain.
So we're blasting the stones apart with sound.
Yeah.
That's so cool.
Which is very cool, right?
Yeah.
And then there are some cases where a little scope needs to be used depending on how big the stone is, or different factors, where they actually go up with a little camera and then they can destroy the stone there and retrieve it.
Destroy it?
Yeah, I don't really even know how exactly they do that. Yeah, I didn't look that one up. And then sometimes for very large stones or more complicated stones, people actually have to have surgery. They'll actually have surgery up by their kidney to remove it.
Dang.
Or a bladder stone that has to be removed surgically if it's big enough that it's not going to pass. So sometimes they actually do need surgery.
That is
Like
crazy.
actual surgery.
Wow.
Yeah. Mm-hmm.
Okay, that seems like really serious. So are there long-term consequences to kidney stones?
I mean, usually I haven't seen many, but the main one would be risk of chronic kidney disease, so like kidney failure or kidney insufficiency, and that would be if you're having a lot of stones, or if at some point you're having blockages from the kidney stone. That would be the main long-term consequence. And then, like I mentioned, if you were to develop an infection in the setting of a kidney stone, that's definitely very serious.
Mm-hmm. All right, so kind of a uncomfortable, scary topic, and I think people probably want to know at this point, what can be done? What are the lifestyle changes people can make to really minimize this or avoid it?
Yeah, so I mean, like I said, the biggest thing people can do is drink a lot of water. I mean,
Drink the water.
Even people that have kidney stones, I have to say, they're still not that great about it. They might drink water for a few weeks or a few months and then they forget about it. So I know it's a habit some people just don't have. For some reason, I am quite thirsty and able to drink water all day, but I know a lot of people don't. But that's really the biggest thing that you can do, because if you're drinking enough water to keep the urine very dilute, then those crystals hopefully won't, kind of bind together and create a stone. So again, the darker your urine is, the more concentrated it is. So the goal, I think, for most people, making sure you don't have any health issues where you can't drink too much liquid, would be to get your urine clear by late morning, have it that way until you go to bed at night. And that's a way to make sure that your urine is really diluted. The other thing, so sugar and high fructose corn syrup should be avoided, a high sugar diet. Also, because like I said, it gets metabolized to oxalate. That's going to increase the most common type of stone. And then salt is another thing. Usually having a high salt diet is a problem as well. But a lot of these interventions, they can be really tricky for people, because say they have diabetes and they maybe should have more protein and less carbs. They're like, well, what am I supposed to do? Because I can't have a high protein diet if I have this type of stone. So I really think the best thing to do is to go see a dietitian. I know the urologists, they're quite educated on it as well, but seeing a dietitian is helpful so they can look at all of your medical problems. So say you have an issue with high blood pressure, or you're on a certain medication, or you're on a diuretic, and so it's helpful. It's not that simple is what I'm saying.
Okay. Thanks for the information.
Yeah.
I think that covers it all.
Okay.
All right, you know what time it's, you know what to do now. It's time to get out there and be a source of kindness, be a source of contribution. You've got something to offer this world, and we believe in you.